what are some of those preliminary game plans that student athletes can expect once they are allowed back on campus?
So initially, we've talked about testing. So can we and do we have the capabilities on different campuses to test our athletes before they come in, or before they actually gather, to kind of know what they're, if they're positive or if they're negative, and so on and so forth. However, then we jump into another issue, and that's if we do test them, the testing that we've learned, there are a lot of false negatives. So how often do we test, and is there actually that capability, both financially and even manpower to do that? If that isn't the case, then we've talked about just quarantining the athletes. So once you get back on campus, you have to kind of be self-quarantined for a period of time, depending on your mode of travel. So your mode of travel, if it's airplane, that puts you at a higher risk for contracting it possibly. And so we've talked about different protocols on how long they would be quarantined in their apartment, or wherever they're going to be staying for the summer. And then most of the plans that we've looked at have kept athletes in groups. So whether that's by position or that's by your housing group. So a lot of athletes do live together. So if we keep them in those groups when they're working out, then there's less cross-contamination of things. Weight rooms are you're going to need to work out at least 6 feet apart. We've talked about masking. So everybody is going to be working out with a mask on. Just kind of bringing people in small groups initially, so that we have enough time to clean everything down, and then the next group of athletes will come in and train.
I imagine, Dr. Chu, that even if the universities are able to execute that to the 100% that they would want, and clean everything and do, take all of the protocols, that inevitably someone, student athlete, is going to come down with COVID-19. So could you walk us through what that would mean?
So we've talked about that scenario, and it is probably one of the hardest scenarios that we've had to walk through. And that is because of contact tracing. So if we can, and I mean, we ask the general public, like, if you had to sit and think about all the people that you might have come into contact with in the past 48 hours, and then what constitutes as significant contact. And so then you have to kind of sift that down and figure that out. A lot of these athletes live with other athletes, and so then that would be an easy thing. But if they were to go to the store and grab whatever they needed, or go to the dining hall and grab their to-go meal, like, who did they come into contact with when they walked by those people? And so how many people do we need to test? So after that, and then do we keep all of those people out of practice if they are athletes? Or do we say, if you're not symptomatic and you haven't been for the last 7 days, then you can continue, if you have a negative test, continue to work out, and then we kind of go from that way? Or do we shut down the whole team? Yeah. So, I mean, there are all these scenarios that we have to kind of look at and think about. A lot of them are surrounding testing and testing abilities. And if we would flood the local health centers or the local labs with our athletes, and take it away from the general population in the community.
Dr. Chu, I know from a federal standpoint, we are seeing the White House institute general guidelines, but the reality is the openings that have continued to occur, that's happening at the state level. We talk about NCAA athletics. What's the more likely scenario? Individual schools mandating certain protocol, or the NCAA saying, look, every Power 5 school, Division I, Division II, whatever the case may be, every athletic program has to follow the set of guidelines? What's the likely scenario once we do get back on campus and we're talking about sports again?
So it's hard to say that there's a blanket over what all schools can do. And the reason is because different areas of the country and different regions are going to open at different times. Sure. And that is just because of the spread. So if you look at the NCAA has put out some guidelines on when athletic departments can reopen. They mirror the guidelines that the White House and the federal government have put in place. But as we have seen, all states are not following what the federal government has recommended, and states have opened and they haven't had that 14-day decline. So then we're running into, so then, you know, there will be schools that might not follow those particular guidelines. And then there's differences. So there are Power 5, there's a Power 5, there's Division 1, there's Division 2, there's Division 3. And so there are a lot of different budgets that we're looking at, that could they actually put together a plan and execute something. And so I think it's very difficult for the NCAA to put something out where everybody has to follow it in stone. But there are some things that they have put into their guidelines where the wording is must and not should. And those things are mainly to try not to add to the spread of the virus.
Are there enough tests available for student athletes when we are seeing a significant need just in the community as of right now? Obviously, that's a few months away, and people and companies want to ramp up. But what's the likelihood that there's going to be the amount of testing and that the schools can afford it?
Yeah, so testing that we've looked at, on average, is about $100 a test. So you can extrapolate that out for a football team, and if you're going to test them when they arrive on campus, and then how often you're going to test them. Are you going to test them every 3 days? Or are you going to test them every week? So if you keep adding those numbers, that is going to cost a lot of money. Yeah. Much like the entire country, athletic departments have taken a hit economically. So financially, there is an issue there. And so there are a lot of different models and a lot of different avenues that I think everybody is trying to navigate. The last thing athletic departments want to do is take away tests from the community. So if there is another way of getting testing done, whether through research projects or some other avenue, then those are the avenues that they would want. A lot of testing is ramping up quite a bit. I mean, I would say every 72 hours, we joke on our advisory panel in the NCAA, every 72 hours things change. Yeah. But testing is the one thing across the country that needs to happen a little bit more robust and a little bit better. And so until that happens, I don't see that it is a model that can be followed kind of by a lot of schools. There are a few schools that are going to be able to follow that model of testing all their athletes or testing all of football or whatever they decide upon. But it is a very hard model to follow.